The personalized care team is a new model of care that the Everett Clinic is going to test out and continue to try and improve. In the United States, we've been finding that more patients are living longer, but more people are living with multiple chronic diseases, and that's true for the vast majority of people over the age of 65 and even some people who are younger than that. When you have multiple chronic conditions, the model that responds to acute needs doesn't always work as well if you have multiple complex needs that sometimes intertwine and cross over. So we're trying to come up with a way that people can learn to live the best life they can with conditions we may not be able to cure, but that we can treat. And do it based on an approach that values the patient's needs and their idea for what would be a good life for them.
There's a lot of variables that we use to determine who is appropriate, eligible, or a good fit for the personalized care team. It includes multiple chronic health issues, multiple specialty visits, multiple medications. Increased needs of the hospital or the ER will also raise the odds that you might be a good fit for the personalized care team. We're noticing that people who struggle with mental health issues are often falling into these categories. There aren't any specific diseases. It's more if you have a large combination of chronic illnesses that it could be a good fit.
Primary care right now seems to not be really reaching patients' needs that have complex problems. So we're trying to put together a way to make sure we're accomplishing their goals and their needs.
So there are many members of the personalized care team, the first being the providers, Dr. Savage, Dr. Finn, and Mary Harris, a nurse practitioner. We have 2 nurses, 2 maybe more medical assistant health coaches. We also have a few other health coaches that are assisting us in making home visits. And we have a social worker, we have a clinical pharmacist, we have a behavioral health psychologist. The home visits is something the Everett Clinic hasn't really explored in the past. The biggest role of our health coaches is really making that bridge between the patient and the provider, especially when the patient can't get into the office as easily as others. So we have the ability to send health coaches out to the patient's home to check in on them, see how they're doing, identify any needs that they have, and communicate back to the provider to see what we could do to help assist in making those better.
The health coach will be available to you as someone who knows you, to work with you, problem solve, address barriers, obstacles to meeting your goals, whatever they are. In addition, the visits will be longer, and we have better same-day access than our current primary care clinics frequently have.
I love my coworkers in the emergency room in the hospital. They are great doctors, they are great staff. However, I think they would be the first people that would say that if we did a better job, a more proactive job at managing chronic, complicated conditions as an outpatient, that ER visits and hospital visits would go down. And so we could eliminate or prevent some unnecessary emergency room visits and hospital visits. The price of the hospital and the price of the emergency room is quite a bit higher than the outpatient world. So we're trying to give a more robust outpatient plan so that we can prevent some of the ER and hospital visits, and that should save money, both for the patient, the insurance plan, and the country, actually.
I decided to become part of the program because I was ready to be part of a team that feels the same way I do. I want to be on the same level as a patient, making sure that they know that we care about them and that we're always here for them.
I enjoy my relationships with my patients, and this new team really allows for that, taking that extra step and really making a more personal connection with each patient.
The number one benefit I see if I were a patient there would be that everybody would know your name and be able to get you in really quickly, kind of like the Cheers song, you know. But I think that knowing individual people and knowing what your problems are allows you to understand where the challenges may be for a person as well. And so it's not anonymous, it's very, very personal, and I think that's the number one benefit.